Hi, my name is Julie Emerson. I'm a registered nurse in the state of Florida. I'm also a master's student at Excelsior University. Today we're going to talk about a quantitative pilot study proposal titled, Can Case Management Prevent Readmissions? We will discuss the research question, the reason this research question is important, what the literature has to say, who is involved in the study and who the study will affect, the budget, barriers to the research study, and what the plans are to carry out the study. And then we will conclude. The research question is, in patients with chronic illnesses, will case management interventions in the hospital setting compared to no case management interventions reduce hospital readmissions by 15% over a 6-month period? I work in case management at a hospital in Ocala, Florida. Chronically ill patients often get into a vicious cycle of returning to the hospital over and over again. Chronically ill patients experience recurrent symptoms, which are expected. When they cannot manage their symptoms at home, they come to the hospital for treatment. Once stabilized, they are given discharge instructions. Unfortunately, many chronically ill patients find that after leaving the hospital for various reasons, they are once again unable to manage their recurring symptoms. Back to the hospital they go for a hospital readmission. Hospital readmissions are costly and time-consuming for patients and frustrating for hospital staff. Furthermore, readmissions clearly indicate that patients' health is not improving. Case managers deal with readmitted, chronically ill patients daily. It can be demoralizing to feel that our work is not benefiting the patients we are trying to help. When patients cannot manage their care in the community and return to the hospital within days or weeks, there has been a failure. As hospital case managers, we must ask ourselves whether we have done everything necessary for this population group when we continue to see readmissions. Since case management interventions have not been thoroughly studied, it is time to conduct in-depth research to determine what works. We can begin our research by establishing whether case management interventions can prevent hospital readmissions. Readmissions are an indicator of the quality of care. Readmissions are costly. Hospital readmissions due to heart failure alone cost more than $50 billion per year, and they are projected to reach about $70 billion per year in the next 5 years. Hospital readmissions are expected when patients are at end of life. However, for most patients with chronic disease, readmissions are preventable. The next 2 slides synthesize the literature on case management interventions and hospital readmissions in chronically ill patients. There is a consensus in the literature indicating that hospitalized patients with chronic illness are more likely to suffer from adverse events post-discharge. However, no agreement exists on the case management interventions required to address these issues. 5 studies indicated chronically ill patients are more likely to readmit within 30 days without hospital case management interventions. However, a follow-up study suggested no inpatient case management model was more effective. 7 studies suggested case management interventions were better implemented during patient transition home, especially during the first 4 to 12 weeks after hospital discharge. However, another study showed that comprehensive transition interventions do not affect readmission rates. Interestingly, hospital doctors and nurses disagree with patients and caregivers about their reasons for hospital readmissions. Patients and caregivers say that the patient was readmitted due to worsening illness. Conversely, doctors and nurses say patients and caregivers simply aren't complying with recommended medical treatment at home. These studies also showed that patients and caregivers don't understand disease processes, how to identify early signs of symptoms, what to do about the symptoms, or who to call, prompting hospital readmissions. Three studies suggested that the key to preventing readmissions is by establishing good rapport with trusting relationships, and that these trusting relationships then empower patients and families and provide them with the confidence to begin to take over self-management of chronic illness in the outpatient or home setting. However, 3 different studies indicated that no matter what resources were provided, some chronically ill patients and caregivers are unable to self-manage chronic illness care. After reviewing the literature on how to prevent readmissions using case management interventions, I could not find a consensus nor any specific case management intervention recommended. Therefore, based on the literature review, I am unable to suggest any practice change, and instead am proposing a real-time case management hospital intervention quantitative pilot study to gauge the results for future studies. The stakeholders for this research project are the researchers who plan the study, obtain approval for it, oversee its implementation, gather the results, and disseminate the findings. The Advent Health IRB will offer guidance and assistance for the study and approve it. The Advent Health Case Management Department will perform the study interventions. Advent Health hospitalists and partnering attending physicians will refer patients to the study. Patients and family caregivers participate in and are the subjects of the study. Additional stakeholders are Medicare, Medicaid, and insurance companies which pay for patient care. Community primary care providers who are penalized when patients obtain primary care services at the hospital. Community health partners such as home health agencies, skilled nursing, and rehab facilities who take over patient care when needed once the patient is discharged from the hospital. Local community where chronically ill patients live. Community members are relatives and friends of chronically ill patients, and the patient's well-being affects them, thus impacting the entire community. The budget for this research pilot study is about $6,700. The bulk of the budget is the cost of the RN case managers for 2 weeks at the beginning of the study. Office supplies are the next most significant expenditure. There is also a projected need for some IT department assistance with setting up workstation on wheels to allow the nurses hired for the project to be fully functional. The case management department has WOWs and SpectraLink phones available for use for this project. Potential sources of funding are as follows. The Advent Health Hospital System in Florida has a research branch called the Advent Health Research Institute, which supports all research in our state. This organization offers funding for nursing research and would be the first stop for funding requests for this project, particularly since the hospital we are discussing is Advent Health Hospital in Ocala, Florida. If additional funding were needed, the insurance company, Florida Blue, a division of Blue Cross Blue Shield, has research and grant monies available. A case management research study looking for ways to reduce hospital readmissions in the chronically ill patient population would likely be an area of great interest to this organization and a project they would be likely to support. Another avenue of possible funding is from the Florida Department of Health via the James and Esther Kind Biomedical Research Program. The Florida Department of Health has partnered with Advent Health to fund public health studies. As case management falls under the public health umbrella, this would be another good organization to go to for monetary support. Finally, there are organizations that specialize in finding funding for research. If funding were still needed after exploring the other options, it would then be time to enlist help from professionals with expertise in this area. Anticipated barriers to this project are time constraints, ensuring staff have the clinical skills needed to conduct the study, acquiring the physical space and equipment to carry out the research, and obtaining appropriate patient referrals. This slide will discuss overcoming the barriers. Nursing staff, nurse leaders, and medical providers routinely cite lack of time as a deterrent to engagement. However, lack of interest or time reported by staff may indicate a lack of confidence in their ability to perform new clinical interventions. When training in skills and interventions with rationales would build confidence and engage staff to participate in the research. Other techniques to overcome lack of interest and support involve the research team educating staff on the importance of the research and the research team collaborating with staff to make study participation convenient. Lack of equipment and workspace might be overcome with the use of workstation on wheels. Case management administration may be able to assist in locating potential study candidates through EMR report tools. The proposed timeline for preparation and research is about 13 months, with evaluation conducted upon completion of the study and 6 months thereafter. It will take about 2 months to prepare the Institutional Review Board documents and procure approval. It will take about 2 months to prepare a budget and obtain funding approval. It will take about 2 weeks to recruit and assemble the research intervention team. It will take about 6 months to implement the interventions and collect the data. 2 weeks are expected for data analysis. 2 weeks are expected to complete the research report, and 2 weeks are expected to disseminate the findings. Again, evaluation of the study will be at completion as well as 6 months after completion. In conclusion, case management interventions to prevent hospital readmissions in chronically ill patients have not been studied well. For this reason, no recommendations can be made at this time for any type of case management practice change. This proposed pilot study aims to determine whether case management interventions can reduce readmissions for chronically ill patients in the hospital setting. The data from this study, combined with analysis from the literature, will determine the effectiveness of case management interventions in this population. Further recommendations about future studies will be determined based on the findings from this pilot study. This concludes the presentation. Thank you so much.